Is it all right?
Do you have a specialty, just for a background?
Sure, yeah. My specialty is internal medicine and psychiatry. I'm trained in both, practice both. So I'm here today as a doctor and a scientist. Many times I've been in the trenches with patients who have exhausted all other pain and nausea management options that are legally available for me to prescribe. Too many times my hands have been tied and I've had to tell patients there's nothing more that we can do for you. Medical marijuana is not yet authorized in Arizona, but it is my sincere hope as a concerned physician and on behalf of thousands of physicians across the state of Arizona who share my concern, it is my hope that today we begin the process where common sense and compassionate medical marijuana allowance in Arizona is finally embraced, as it has been throughout this country. The evidence is overwhelming that medical marijuana, it does relieve pain, nausea, vomiting, and other severe symptoms caused by such illnesses as multiple sclerosis, AIDS, and cancer. And medical marijuana can do this with remarkable safety. In fact, marijuana is less toxic than many of the drugs that we physicians prescribe every day. Seriously ill patients who use medical marijuana do not get intoxicated. They titrate their dosage to obtain the needed therapeutic effect, and then they stop. Scientific studies have conclusively demonstrated the value, the medical value of cannabis, and available antiemetics often prove ineffective for patients. They often result in patients continuing to have malnourishment, intractable nausea, weight loss, delayed chemotherapy treatments, and decreased survival rates. However, seminal studies by Dr. Donald Abrams at the University of California in San Francisco show that patients receiving medical marijuana have improved immune function and compared with those receiving placebo, and many of those patients gain 4 pounds on average over those patients getting placebo alone. The evidence compiled by renowned investigators throughout this country and published in peer-reviewed medical journals show the remarkable and undeniable health benefit derived from medical marijuana. So the point is simple. It is vitally important that seriously and terminally ill patients have legal access to safe and effective means of treating their illness. The potential benefits from medical marijuana greatly outweigh the risks. The Arizona Medical Marijuana Initiative allows doctors to provide the highest standard of care and taking care of patients and allowing compassionate use of medical marijuana for seriously and terminally ill patients with a doctor's recommendation. I urge anyone who has personal experience with a devastating disease or who knows someone who has battled with such an illness to vote yes for medical marijuana in Arizona. For those of you who have been lucky enough to avoid serious illness and have never touched marijuana, I urge you to consider this possibility. Someone you love may require medical marijuana someday. Please support this proposition. The current and future patients of this great state of Arizona will thank you, and I thank you all for your attention.